Good afternoon, everyone. Welcome to Promoting Safe and Stable Families Peer Learning Call today. My name is Sharon McKinley, and I am the Senior Consultant with the NRC for In-Home Services, which is funded by the Department of Health and Human Services. And so on behalf of the NRC for In-Home Services, we want to welcome you to our Peer Learning Call today. Today's topic is on family engagement. And so we hope to have a good discussion here. Before we get started, I hear some background noises here. So ordinarily I would ask who's on the phone, but I think we got a lot of people on the call today. So we're going to skip that one and ask that if you could, please *6 your phone so that you can be muted. If you have mute on your phone already, you can just hit the mute line. But we want to make sure that there's no background noises, because I'm understanding that sometimes that can be a problem. Before I introduce our presenters today, I want to give a small announcement, first of all, that we are having our final PSSF Peer Learning Call in September. And to ensure that we address the topics that are of interest to you, can you all *6 your phone, those who are just coming on? Thank you. To ensure that the topics that are of interest to you for September call, we ask, I'm going to send out a email that will have a SurveyMonkey for topics. And if you can complete that, that will allow us to have your input into the September's discussion. So to get started today, I want to introduce to you, first of all, two of our state managers. Vicki Audis, she is with the Delaware Department of Family and Children's Services. She has provided services to the elderly, to children and their families in the field of genitology, plus 25 years in direct services and service administration and program development. Through her career, Ms. Audis has championed several causes and paramount to families in America. In the past 7 years, she has supported the research, planning, and development and implementation and promotion of Delaware Promoting Safe and Stable Family Consultation and Support Program and the Delaware Father and Family Coalition. Ms. Audis is the DFFC Infrastructure Chair and services as a member of the Coalition Guiding Team Committee. As the Infrastructure Chair, she has co-facilitated the development and implementation of the County Pacific DFFC County Leadership Committee, along with establishing collaborative partnerships through that committee and the Delaware Promoting Safe and Stable Family Consultation. She obviously has many years of experience, and so she will be taking the lead today. But we also have on the line with us Ms. Peter Lewis. She is the project manager in the Family Services Division at the Virginia Department of Social Services. And she has more than 20 years of experience in program and project management, program development, policy development, implementation, fiscal management, and budget development. Ms. Lewis has worked in the areas of child welfare, prisoner reentry, homelessness solutions, family drug courts, and fatherhood. Ms. Lewis has served as a Virginia Commonwealth University field instructor for social work students. She is a graduate of Virginia Tech University with a BA in Public Relations and Communication Studies and a minor in Sociology. And she also has her master's in social work from Virginia Commonwealth University. So we welcome them today. And I'm going to turn it over first to Vicki Artist, and she will take the lead in the presentation. I just want to say before you get started, Vicki, for those who are just coming on, please start fixing your phone so that we won't hear any background noises. We thank you for your cooperation.
Okay, Sharon, this is Vicki Artist, and thank everyone for joining us for today's peer learning topic. I am representing Delaware's Promoting Safe and Stable Families program, and we'll be sharing with you some engagement strategies that we have employed here in the state. Next slide, please. It is my,
excuse me.
That's okay. It is my sincere hope that by the end of my presentation today that you all would have, I would have shared strategies that we're utilizing to support father engagement within the state of Delaware, share some of the activities and events that are occurring to support father engagement, and also to share engagement strategy outcomes and evaluation methods that are being employed here in the state. Next slide, please. Delaware's Promoting Safe and Stable Families program partners with the Delaware Fatherhood and Family Coalition in 2006, but in 2007 to implement throughout the state a fatherhood survey. Now, the Delaware Fatherhood and Family Coalition, it's made up of a conglomeration of state agencies, faith-based organizations, grassroots community-based organizations, and individuals who share a common interest in helping fathers to engage with their children and with their families. In the 2007 Fatherhood Survey, its origin and reason for creation was to gauge what men throughout the state of Delaware felt about fatherhood. It was the hope that the outcome of the survey would help to guide the Delaware Fatherhood and Family Coalition with developing strategies or strategic plan of how to better engage fathers into services in the lives of their children. Next slide, please. And that is the report is available, and I will share that information of how you can obtain that report at the end of the presentation. Next slide, please. So some outcomes of that 2007 survey. The first thing that was the survey did was it identified identification with the father's role. The survey found that 93% of the males surveyed, they embraced their roles and desired to be good fathers. But also it found out from other questions supporting this that a lot of the fathers, 93% actually, were searching for and were not quite sure how to be fathers or how to be engaged and involved with their children and families. The second thing that the survey revealed were barriers to fathers becoming involved with their children. As they're listed here, work schedules was number one of the list. Children's mothers, rated 85% of them, said that was a barrier. 83% noted legal matters as being a barrier, and 79% money issues were a barrier, and 76% of the male surveyed noted relationships with their children's mothers as a barrier. The survey findings also noted additionally that men were allowing external challenges to become barriers to their participation and involvement. It was hypothesized that if the knowledge of fathers increased about the importance of their involvement, that these barriers, these external barriers, would decrease over time. The third finding of the survey was a question posed around the importance of marriage. 63% of the males surveyed believed that marriage was important. However, from various focus conduct survey and its findings, there were varying reasons determining why marriage was not always possible or desirable. The fourth survey finding from a group of questions were around relationship with the child's mother. 96% of the male survey believed it was very important to have healthy relationships with the child's mother. The fifth component of the survey questions centered around the role of government and churches. 88% surveyed agreed that churches and faith-based groups could have a positive role in helping fathers, parents, raise their children. Additionally, in focus groups, it was from the survey around this component, that males felt that agencies were more interested in and were biased toward supporting and providing services to mothers. In conclusion, the study's findings revealed that fathers embraced their roles and wanted to be involved, but lacked confidence in their abilities, their knowledge of parenting, their knowledge in having healthy relationships with the children's mothers as being barriers to their involvement. But overall, that they wanted to become better fathers to their children and be engaged. Next slide, please. As a result of the survey findings, the Delaware Fatherhood and Family Coalition developed these strategies, which they are currently using to engage fathers throughout the state into services, activities, educational opportunities around children's services and their families and communities as well. The first strategy is to promote father involvement as a positive influence. This is done by increasing community awareness of the importance of father involvement and establishing in the efforts to establish and have established commitment to father involvement in the lives of their children through various vehicles throughout the entire state. The second strategy employed is building a self-sustaining, self-determining father and family coalition by stimulating a broad-based positive social movement to combat father absence and promote father involvement. The third strategy utilized is provide fatherhood education and opportunities for technical assistance in the area of fatherhood by providing fatherhood and healthy adult relationship educational opportunities throughout the state and technical assistance to any organization, formal and informal, that is interested in increasing their capacity, understanding, and ability to engage fathers into service throughout the state. The fourth strategy is to promote fatherhood and co-parenting services throughout the state through fatherhood and co-parenting services as well as activities that are occurring. The coalition, while we found in the survey that many of the men surveyed were not married, there was the outstanding thought and belief that effective relationships, healthy relationships, be it a husband, wife, a paramour and child, a stepfather, uncle, or grandfather, any person involved in a family and in the lives of the children needed to have a nurturing, healthy relationship with that mother. Next slide, please. Activities associated with the strategies being employed. Promoting father involvement as a positive influence. A few activities that have occurred and have been successful and continue to occur are fatherhood education awareness trainings for informal and formal support service agencies. The coalition, with support of Promoting Safe and Stable Families here in Delaware, we at one time hosted for a year educational workshops and trainings for agency service providers around healthy environments, father-friendly environments, because what we have assessed and surveyed and knew that most of all of our services were geared toward and accustomed to servicing females. So we had to do a little father-friendly check assessment on our way of delivering services and our own biases toward fathers seeking services. Another activity around promoting father involvement as a positive influence was around, we hosted town hall meetings on various topics around fatherhood that men surveyed had an interest throughout the state. Also, there was, we do social media, conversations through PSAs, blogs around various topics around fatherhood to have a healthy exchange of knowledgeable information. Then there's also the Delaware Fatherhood and Family Annual Fatherhood and Family Summit that kicked off its first summit in 2010, and they continue to host annually each year. I'll give you more information about the summit toward the end. And then there are community father and family awareness activities such as Father's Day breakfast, Mother's Day teas, father and family bowls, father and daughter events, father and children talent events, where the coalition partners with various entities throughout the state that are working with children and bringing in that component to incorporate the parents into the activity, exchanging information and providing educational information on the importance and building upon these activities. That these are activities that have been sustained throughout the initiation of these strategies for the coalition throughout the community. Next slide, please. The second strategy, building a self-sustaining, self-determining fatherhood and family coalition. And some of the activities occurring around this strategy, the implementation of county-based Delaware Fatherhood and Family Coalition leadership committees. We have 3 counties within the state, and each county has what we call the CLC that represent and make up the the infrastructure, we call it, for the Delaware Fatherhood and Family Coalition. They meet monthly and discuss what's happening within their county specific around fatherhood and family events. They host and partner with community organizations around activities, and they promote and provide educational opportunities throughout their counties. Again, there's a DFFC faith-based initiative where there's church organizations for each county that come together and have joined the coalition supporting the cause and work within the faith-based arena around addressing fatherhood issues throughout their prison ministries within the church, men's groups, hosting men's breakfast, educational services, pen pal for a pen pal program for the prison ministry as well. And then the Delaware Fatherhood Family Coalition has also county ambassadors. These are a group of trained individuals throughout the state in each one of the 3 counties that go out and speak upon request to organizations, formal or informal, that are interested in finding out and receiving more information about father engagement, father involvement in healthy adult relationships. They also host trainings on the subject matters as well. There are partnerships throughout the state, primarily partnerships with loan partnership with the Child Support Enforcement, our Department of Health and Social Services throughout the state that have been with the coalition from ground zero, I would say. The coalition has hosted in trying to build that and sustain its efforts throughout the community grant writing trainings. While the coalition does not have money and the partnerships A lot of volunteer, a lot of in-kind services are provided to help sustain the activities of the coalition. But by the same token, wanting to build that capacity in the community, they hosted a year-long and continue upon request grant writing training so that entities of the state can have opportunities and be better equipped to go out and seek funding opportunities that are made available through grant writing. And of course, there's a coalition training that was a partnership with CACA in helping to bring awareness and in the development and building of the Delaware Fatherhood Coalition. CACA partnership to provide that training throughout the state for the coalition, and now continues to serve as a technical advisor to the coalition. And of course, there are ongoing statewide membership drives. Next slide, please. The third strategy, providing fatherhood education opportunities and technical assistance in the area of fatherhood. The coalition collaborates and partners with entities in the community to provide these activities. They have a community dialogue, which is hosted through barbershops and salons throughout the state. Each month they have a healthy discussion, a dialogue around a fatherhood or healthy adult relationship topic within a barbershop or salon. The shops are trained, the staff are trained around how to facilitate and are provided and coached and receive a training on the topic subject matter that they'll present on and host the conversation throughout their shops each month. Again, there are Ambassador Fatherhood presentations throughout the state, and there's fatherhood and co-parenting and parent education workshops that are hosted in partnership with other agencies throughout the state as well. Community workshops and service provider presentations. The fourth strategy, promoting fatherhood and co-parenting services throughout the state as a strategy. The Division of Prevention and Behavioral Health throughout its services that it's providing, that the coalition is able to go out and present to the various services within the division and partner in terms of increasing staff knowledge around services and the importance of engaging fathers in the services that they're providing to children as well. Of course, there's a Promoting Safe and Stable Families program, consultation and support program that is a consultation and support program that works with families and also have been trained to engage and employ fathers into the consultation process. And again, working with the Division of Family Services around really engaging those fathers.
Family Services is Melissa.
Oh, hello. And engaging fathers into the service. The faith-based community are involved with, and community organizations and formal and informal support. Next slide, please. So, engagement strategies and activities. Again, here are some of our engagement strategies I just kind of referenced, but next slide, please. Outcomes and evaluation. Strategy 1, promoting father involvement as a positive influence. The goal, of course, is to provide educational opportunities to fathers, to community service providers, addressing the impact that father absence and involvement have on the lives of children. The objective is to support local fatherhood and healthy adult relationship conferences and training opportunities to provide opportunities for fathers, families, and the community to become more enlightened and aware of just how critical and important involvement is. The outcomes have increased the awareness and the knowledge that these entities have on the importance of engaging fathers. The evaluation tools used have been satisfaction surveys, pre- and post questionnaires given at town hall meeting conferences, informational sessions, and workshops. Next slide, please. Strategy 2, building a self-sustaining, self-determining coalition. We've talked a little bit about, but and its objectives: fostering a community partnership through Fatherhood Coalition, infusing father initiatives into existing services, I would say, have been two of the key components. Next slide. Its outcomes have been to establishment of the CLC, the County Leadership Committees throughout the state, in each one of the counties, and ongoing quarterly town hall meetings, father events, and informational sessions. The evaluation tools are the same: satisfaction surveys, surveys of fathers' increased level of knowledge, and satisfaction surveys on the value and quality of the literature that's been disseminated throughout the state around fatherhood involvement. Next slide, please. Strategy 3 provides DFFC education and technical assistance. We talked a little bit about that throughout the presentation. And primarily the goal is to provide that educational knowledge-based opportunities and technical assistance to providers that are interested either infusing father involvement engagement services into existing services or establishing those services. The again, outcomes are the increased father-friendly services, decreasing barriers to fathers accessing service. Evaluation tools, again, are participant satisfaction surveys and surveys of fatherhood participant agencies' service on the educational and the service supports that they've been provided. Next slide, please. And the fourth strategy, promoting fatherhood and healthy co-parenting services. Our goal, again, promoting fatherhood and healthy adult relationship services, the activities, and its importance in the lives of children. And again, its outcomes, increasing awareness of the importance of healthy relationships and fatherhood in the community throughout the three CLCs, and the importance of healthy adult relationships as it affects parenting relationships to children. Evaluation tools, again, satisfaction surveys, pre-post questionnaires are given quarterly at the town hall meetings and community workshops, and then satisfaction surveys of the value and quality of the literature being provided in these activities. Next slide, please. A few things that have come to mind that I would say we always should keep before us is that the earlier we engage fathers into services, into the lives of the children, the better, and we've been more successful in maintaining those involvements in our activities when we engage them on earlier. Also, the ultimate benefit for engaging fathers is the child. We always keep that before and are sharing that with our communities. And we should keep in mind and remember that women and female human service professions are critical to the success of engaging fathers. One of the tools that we often use for engaging fathers in community activities, we work through the children through various activities and organizations by having them to actually formally invite, formal invitations inviting them to the various activities, lectures. And lastly, fathers need the same resources we should keep in mind and supports as mothers to be effective parents and to be engaged and active into the lives of their children and families. Next slide, please. In conclusion, if there's information and questions, here's contact information. The slides will be made available. The one thing I would like to also add that the Delaware Fatherhood and Family Coalition will sponsor its 5th Fatherhood and Family Summit, October the 10th and 11th, here in at the Chase Center in Wilmington, Delaware. That information can be, more information can be obtained through the website that's noted on the slide if you are interested. Thank you for the opportunity.
Thank you, Vicki, so much. I want to do something a little bit different. Normally, we wait to the end of both presentations to see if anyone has any questions. But I just want to see if anyone have any questions they might have for Vicki right now. You can start checking your phone and ask her, or you can also use the chat box to put your questions in. Any questions? All right. If there aren't any questions, we will move on to Makita. Makita?
All righty. Good afternoon, everyone. I'm going to talk a little bit about engaging fathers in Virginia, and the presentation is mainly about I would say, a systems level and that approach. So next slide. When we're working with our partners, whether they're local departments of social services or government agencies or community providers, we like to try to, is there feedback?
There's feedback. I think someone might be using their computer along with their phone. So you have to do one or the other. Okay.
So we like to think.
Also, you need to fix your phone.
Well, it has a mute button.
Okay, let's see if that's working. I don't know if that's working. We still need someone to fix the phone. If you use the computer along with the phone, we're going to have this echo.
You can only use the phone, not the computer.
Right. You can only use the phone, not the computer.
For the audio.
Okay. Makita, you want to try again? Makita?
Hello?
Okay, I still hear some echo there.
Me too.
Okay, try it now.
Look, listen, and respond. So next slide.
All
The
right.
only thing I have open is the slides and my computer. I'm not using anything else.
Okay. Okay, try and see what happens. You just have to work through it.
Okay, so topics for discussion, strategies. Next slide. We all know that when fathers increase the quality and quantity of time they spend with their children, outcomes improve. Next slide. In 2010, the Virginia Department of Social Services launched what we call a Strengthening Families Initiative. And even though we no longer refer to that work as an initiative, we knew that connecting and reconnecting fathers with their children and families would be an important part of this work. So as part of that initiative, or as part of this work, we had a specific targeted outreach to our community partners and faith-based partners. And we did this mainly because we knew that father absence and the lack of father engagement was mainly a community and cultural change, whether it be at the organizational level or at the community level. So we relied heavily on our community and faith-based partners to help to make this change. So we developed some strategic partnerships to get this influence at the community level, and it was very grassroots at the community level. One of our goals was to establish partnerships with close to 500 community and faith-based organizations by the end of 2014, and we have reached that goal. We have a strategic partnership with the City of Richmond, the Virginia Department of Health. They have a coalition or initiative called the Richmond Family and Fatherhood Initiative. This initiative utilizes a community mobilization strategy. That strategy uses focus groups, forums, and training institutes. And I find it very interesting that in Delaware's survey, how they found that government and community partners were a big influence for fathers, and so we found that too. So in our focus groups, we have a series of meetings with local leaders exploring the whole social and economic impact of father absence in their part of the city. So when we do focus groups in the cities in Virginia, we usually go out with a locality profile that shows the impact of father absence in their city. So we look at the cost of single-family households, we look at taxes, we look at benefits, we look at child abuse and neglect, we look at a lot of domains in the city. We also hold citywide forums, and that's a gathering of 100 to 200 leaders from government, education, public health, law enforcement, media, faith-based organizations, and community organizations, looking again at the social and economic impact of father absence in their city. Then lastly, we hold a training institute, a series of 1 to 3 day training opportunities for leaders, providing certifications and trainings on fatherhood, manhood, domestic violence prevention, mentoring, risk reduction, healthy relationships, and co-parenting. Part of these strategies and this work for connecting and reconnecting fathers with their children meant that we adopted this community mobilization strategy and model and utilized this model and replicated it in other areas of our state. So in Richmond, we experienced a lot of success with that model, and so the Virginia Department of Social Services, the state agency which serves as the backbone for this type of work, has replicated that model throughout areas of the state. Another part of this strategy is making sure that these focus groups, forums, and training institutes came together in a more formalized committee, so to speak. So they formed family and fatherhood steering committees in each region of the state. We have 5 regions in Virginia: the northern region, the eastern region, the western region, and the central region, and the Piedmont region. In each region of the state, we have family and fatherhood steering committees, and we have a total of 19 committees. On these committees, we have representatives from our local departments of social services, reentry councils, government agencies, churches, faith-based partners, private service providers, anything that basically a father would need if they were returning to the community after being incarcerated or if they just needed support. So we have those steering committees in each of our cities. The curriculum that these steering committees utilizes are several. We wanted to make sure that these people on these committees or the persons on these committees understood what fatherhood is all about and understood the importance of engaging fathers. We use father development curriculums from the National Partnership for Community Leadership. We use Inside Out Dad. We use Healing the Father Wound. We use 24/7 Dads. We use How to Raise a Man. And we use Understanding Dad and Mom as Gatekeepers. Another of our strategic partnerships is with Casey Family Programs. That's a private foundation partner. You all are familiar with several arms of the Casey Foundation: Annie E., Marguerite, Jim Casey. Well, we work with Casey Family Programs, and they have supported this work in Virginia. Basically, we were able to engage Casey Family Programs because they were very interested in the community mobilization strategies, because they do a lot of work around capacity building in communities and around engaging communities of hope. Their basic premise is that communities should be able to support families and children, especially when it relates to reducing the number of youth in foster care. So that's how we aligned our work with the Casey Family Program's 2020 initiatives and goals. As I said before, the Virginia Department of Social Services serves as a backbone support for a lot of this work around fatherhood. And within our internal agency, the way we engage our local departments of social services around fatherhood is to utilize our quality service reviews. And in that review process, which is very linked to your child welfare and those improvement profiles, we looked at how our local departments of social services child welfare work was doing when it related to engaging fathers. And we found that a large portion of those local departments of social services needed to do better in that area. Results indicated that in some instances, workers did not consistently engage fathers. And so we recommended things like developing fatherhood engagement initiatives at the local level, increase fatherhood and case involvement from the beginning of the case, increase documentation of daily contacts with fathers, conduct staff trainings on fatherhood involvement, and implement fatherhood initiatives along with the steering committee. So as a result of that, a lot of our local departments of social services are also participating on these family and fatherhood steering committees in our localities. Another initiative or strategy is our Virginia Division of Child Support Enforcement. And our Child Support Enforcement Division is following the bubble chart out of the federal government and trying to be more family-friendly when engaging with not only fathers but mothers, too, who are non-custodial parents. The Division of Child Support Enforcement has developed a pilot project called Family Strong, which is working with fathers who are returning to communities after being incarcerated. This Family Strong pilot project will involve intensive case monitoring for fathers, so they will get pre-release support, and once they are released, they will get support around housing, around employment, around preparation for employment, access and visitation with their children, supervised visitation, relationships with private providers that will support them with therapy and in-home counseling, and then maybe even some stipends to get them to working. So that's our Family Strong project out of the Division of Child Support Enforcement. We also utilize our university partners and their schools of social work in our regions. Our university partners are very important when we talk about evaluation and outcomes and logic models. So next slide, please.
Before we do the next slide, I am going to do star 96, which will mute everybody's phone.
Okay.
But Makita, what you will need to do is star 6 yourself so that you can be heard only, okay?
Okay.
So hold on. Let me do this right now. Let's see how this works.
All guests have been muted. You can unmute your line by pressing star 6.
Okay, now Makita, you can do star 6 to unmute yourself.
You are no longer muted.
Okay, now let's see how that goes.
Okay.
Go ahead. Oh, I need to advance the slide. Okay, let's see. Okay.
Okay, so
Much
one
better.
of our okay, is that much better? One of our challenges has been decreasing resources. Like I said, we have relied a lot on private foundation monies and some grant monies and even some general fund monies from the state. But we have some competing priorities, so what we're utilizing right now is still some of our foundation monies and our general fund monies, and to help these local steering committees that have formed around family and fatherhood, help them to do some capacity building on their own, because as you know, as a government agency, we can't continue to fund all of these projects at this level. So what we've tried to do is target steering committees that have begun to drill down with evaluation, that have begun to develop some data collection methods, that have begun to collect some data around some of the outcomes, and that have begun to do some capacity building and benchmarking. So a challenge has been decreasing resources. And again, another challenge has been a lack of a shared measurement system. We try to utilize what we call a collective impact model, but sometimes some of our localities are, tailoring or customizing some of their work to their local communities. So at the state level, when we have legislators and at the secretariat level and the cabinet level asking for statewide outcomes, we have found it challenging to get a consistent measurement around outcomes. Like we don't have everybody measuring the same thing. So I am very interested in the survey and the results that Delaware has completed so that we can have some type of consistent measurement tool and a consistent outcome that we're looking at across the state. Again, a defined evaluation plan at the state level. How do we evaluate all of these pockets of work at the state level? We know that we're doing pockets of work in each area of the state, but how do we have a defined evaluation plan so that we won't discourage folks from customizing the work according to their local needs, but we want to encourage also a consistent evaluation plan. Next slide. Identifying various funding streams. So again, how do we work creatively to look maybe some 4E funds or some benefits funds and kind of guide those funding streams to support some of this work? How do we utilize more of our PSSF funds? We know that our localities work with our local departments of social services to identify needs that they can utilize their PSSF funds for, and some of them have identified the need to engage fathers and to work with them, but they don't build into a mechanism into their ask for PSSF funds. How do we develop new collaborations? We know that there are a lot of partners in our communities who are interested in child welfare as it relates to trauma, as it relates to child well-being, as it relates to permanency. How do we collaborate with those partners around engaging them around fatherhood or the lack of fathers' engagement and how that impacts child well-being? And maybe we can collaborate with them on some of the work around the monies that might support some foster care type of things or permanency type of things, because we know that father absence does impact permanency. And to continue to use a community mobilization strategy, we've had a lot of success with that and bringing a lot of partners together. And some of those partners have been able to access specific funding streams on their own, from whether it's reentry, community mental health, or CSBs, and so we want to continue to work with that. Next slide, please. And now, any questions, and thank you. You can feel free to go to our VDSS website or contact me individually at my email listed above.
Thank you, Makita. I want to open this up to make sure if you all have any questions that you can type them in in the chat area to make sure I didn't miss anybody. Okay. If you have any questions, you can put them in the box with questions or chat, as well as you can *6 your phone. Just say if you have any questions for either one. While we're waiting for that, I want to ask Vicki, in regards to your staffing, I know you said you have volunteers for the coalition, but who else, do you have any other staff working in regards to that other than yourself? I mean, is there a team, a group of people, or *6 your phone to be able to unmute yourself?
Okay, thank you. There are staffing, actually besides myself from the state level, there is my program manager, Mary Pope, and I are the only two state staff persons, representatives to provide support. The coalition has a coordinator, a staff coordinator, and then a training coordinator, and a communications coordinator would be, if you want to consider staff, the only paid positions that are operating throughout. The coalition is entering a period of time now where it is able to seek granting opportunities, and hopefully we'll be able to offer stipends in the areas of community education and trainings, having trainers available throughout each one of the 3 counties that provide these trainings, and also participate in data collection, in the data collection process, which the coalition's communication media web person, we also are hoping are ascertaining survey information and data, collecting that information through the web vehicle. So that's, in terms of staffing, would be what the staffing is made up of in terms of staff.
Okay, thank you. And then you mentioned about having the discussions in the barbershop or the salon. Do you know how many barbershops or salons that are participating in that?
Not right offhand. What I do know that comes out to mind that throughout the state, well, 2 counties throughout the state, there's a total of 6 that I'm aware of that are existing or have been existing for the last, I would say, 17, 18 months. What new ones have come on in 2014, I'm not really aware of, but have been a consistent with that number. I do know the plans of engaging for Sussex County, which is the county further south in the state. They were piloting with one county, Newcastle County initially, and then in 2014 we're engaging Kent County, which is the middle county in the state, and then plans to engage by the end of 2014, have engaged at least 5 barbers and or salons for Sussex County. Right now they are on target, and I guess right on target for what they had planned to have accomplished for 2014, and have plans to begin working on training to identify barbers and salons for Sussex County. That's another 5 to be added on.
I do have a question here. It says, what is the difference between the children's mother relationship with mother as a barrier? I think that was to you, Vicki.
As a barrier, a lot of times, and the coalition is branching out and have constantly, one of the feedbacks from various types of surveys, educational surveys, is the need to make that awareness to mothers of the impact that they can possess. What we found with the coalition survey really found that the men were hesitant engaging with the children based on their relationships with the mothers. And it has been the coalition's educational trainings and the workshops and the various program trainings that they've employed throughout the state through the different curriculums through NSI and other entities, that their relationship, that the father-mother relationship should be such that it should be supportive of what's in the best interest of their child, to learn, to understand, to separate the two. We hear, and what we've also found out through some of the surveys is that not only usually that the father's reluctancy, because either they've moved on or not being able to separate a healthy relationship that's not based on your status of intimacy or personal involvement with the mother, but still separating the fact that, you two both share shared interests. So a lot of times mothers not taking into consideration that not engaging or not reaching out for the support, regardless of what the outcome may be, acknowledging that father, having an awareness of the importance of that father's participation, the level of stress that could be reduced by just engaging that father in some of the activities, or just having knowledge about sharing the knowledge that a mother as a primary caregiver of a child would have to the fathers, because of their lack of healthy, supportive parenting relationship to the child's father. So that's some of the barriers that fathers have encountered or reported in their engagement and lack thereof throughout the various activities that have been hosted here.
I noticed that you provided, oh, wait a minute, is there a question? Just want to see, first of all. Okay, there's another question here. Let me see. I just want to make sure that I get this question in. How were you delegated to earmark PSSF funds solely for fatherhood work, and has it always been this way? Was it a leadership decision? And that's for, I think, both of you all? Yes, or Makita. Trying to figure it out. Or Makita, were you asking that question?
I was asking for Vicki.
Okay.
Okay. First of all, having to obtain permission correctly, and from the funding source through the in submission of the grant every year, and writing out responses to the funding source to Title 4B, Title 4B Subpart 2, and writing in the program's plan of services and addressing initiatives. So each year, the program manager, Mayor Folk, has had to write in her plan permission and give justification of a certain amount of funds from the family support and preservation funds to be allocated in support of this initiative. Like Marquita has noted, of course, that amount has decreased tremendously over the years because the intent was to support the establishment of a self-sustaining entity within the community, driven by the community. So each year, and also from the federal level, she does the same thing on the state level within the Children's Department, who also has to seek and obtain the approval, governor's approval of all program budgets within the department.
Okay. Thank you.
Thank you. And I have one more question. Since you gave the outcomes, what you were looking for, and how you are doing it, Vicki, do you all have a report out to show of these surveys? That this is the the results of for the participant surveys and that sort of thing. Do you have a report out of that to to show what the results were?
We have, I would say, up until probably last year in terms. Let me just start with one component: the annual Fatherhood and Family Summit would have a report out from the evaluations and the surveys from the various workshops and the summit as a whole up until, I think, last year. In terms of the other community educational and activity surveys, we have the information and are in the process of just establishing a suppository, or being able to abstract the information to start to analyze and create reports. We do have, I do know that the coalition coordinator does have an annual report that summarizes some of the findings that he's been able to assess in terms of the overall operation and service impact, community impact on the community the coalition has had. But in terms of each individual activity, training session, hosted, co-sponsored, we still are working toward establishing consistency in terms of obtaining that data, collecting that data, reporting that data, and then having a mechanism by which we can assess and report out.
Okay, thank you. I just want to check and see if anyone else have a question, or if they would like to have a comment, or just a share for 1 minute about what they might be doing in their state in regards to fatherhood, father engagement. Okay. Well, I want to thank Makita and Vicki for taking the time to present today. I do want to say to those of you who are still on the phone that at the conclusion of the peer learning call, I'll be sending out an email to ask that you take this survey, please, to kind of give us your feedback. And again, for September, we want to know what topic you would like to have a discussion on. And so if you can do that survey, I really, really would appreciate that. And I would like to say on behalf of NRC for In-Home Services that I really appreciated everyone who has participated in the peer learning calls over these past few years, as well as those who have participated in the grantee meetings when we were able to have them. And hopefully when the next round comes through with this new center that's going to be starting up, that perhaps they will be able to, have, more grants, that sort of thing. But again, I just want to say thank you all for participating and being a part of the peer learning calls. Having said that, you all have a wonderful and blessed day.
The host has